how do we help it? Um, so rehab, now people think it's going to be taking, a few sessions of acupuncture, which is going to make it feel better. I have nothing wrong against acupuncture, but I find that looking forward to just sort of passive treatments, that's not going to get you results. Wearing a strap and playing, yes, you might get away with it, but then for how long? And in rehab, don't expect your elbows to sort of bounce back just like that. An injury can take 3 months plus. And when I mean plus, I've had people for 18 months having elbow rehab because they've just not been able to understand that every time they go and provoke it, we're back at the starting line sometimes.
And the reason for that, Ross, again, sorry to interrupt you, is that it's not just a simple inflammation. We need to let the patients understand that it's not just a simple inflammation of a tendon. Unfortunately, in these conditions, especially when they become chronic, when they last more than 6 weeks or 2 months, then the tendon itself changes its substance. It's the fibroblasts, for example, the cells which are producing collagen are becoming swollen. They multiply. There is an influx of vessels into the area, and you get what we call angiofibroblastic hyperplasia. That's the medical term. Basically, the form of the tendon inside changes in a way where a simple rehab or just putting a brace simply will not improve the symptoms. Hence the persistence of the symptoms and the need for further treatments.
Yeah, absolutely. Thank you for sort of going on to that, because it's important to understand that once that structure changes, there's going to be time required and enough stress required on that particular tendon or the area to sort of almost reverse the process, and that can take a while. One of the things we have our famous is that our bodies are not Amazon Prime. You can't get next day delivery. So this is the thing with rehab especially. But that's not to say that you can't address a few things. So pain management is another thing. I know people do sort of go straight for the anti-inflammatories. They go straight for cocodamol. They'll get prescribed some stronger painkillers from the GP, and I'm not necessarily against it, but I'm also not necessarily going to say you can just take painkillers. I know there's a lot of golfers out there who take 2 ibuprofens before their round of 18 holes. They'll go and have their lunch at the clubhouse, and then they'll carry on taking another 2 hours, another 2 painkillers, ibuprofen after playing golf. And this is not the way to kind of like be dealing with injuries.